Hi, everyone. It looks like it's about time to get started. My name is Hilary Dunn-Ridgway, and I'm with the Schlegel-UW Research Institute for Aging, and we are very excited to welcome you to our next Walk With Me webinar. So we are continuing on our series called Rethinking Senior Living, and today's webinar is a new vision for family care partners. I will introduce my colleague Sherry in a moment, and she'll introduce our presenters, but we just wanted to talk a little bit about what Walk With Me is. So it's really our Canadian movement for culture change. We are bringing together people from across the country to learn with and from each other about how to change the culture of aging in Canada. We usually have a conference every 2 years. We have postponed our 2021 conference until 2022 in hopes that we can all gather together safely. So we're hoping you can all mark your calendars for May 26th, 27th, 2022 and join us in Calgary. I think all of us will be excited to have a vacation at around this time next year. We have a great lineup of speakers. We are going to hear from them next, and then we will do Q&A at the very end of the webinar. So we would ask you to send your questions and put them into the chat in the Zoom webinar. You're welcome to address questions to individual speakers, or you can send a question to the whole group, and we will answer them together at the end. So next, I would like to introduce Sherry Schaefer from CapitalCare. She is my co-chair for the Walk With Me Planning Committee for the conference, and she has a few words, and then she'll introduce our speakers.
Morning, everyone, or afternoon, depending on where you are in the country. We're so thrilled to have so many people from across Canada to be joining us today. This topic that we are talking about today is really quite a crucial piece for us because the families are a critical part of the care team. But what we're looking at and what we've been talking about is how do we really see some change and see some opportunities open up for families to really become care partners in the time that a loved one is in a care setting, whether that's in a congregate living or at home. There's so many opportunities, and a lot of the families would like to be more involved, but we know from our perspective at CapitalCare, we've seen where families come in and they really feel like they need to be hands off because that's been tradition, and the staff take over for them. In some cases, that's what they need, and that's okay. But if the family wants to be involved, how do we do that? And we're talking actively involved, not just a social visitor. We're really looking at the active involvement. So whether they're being a real active advisor to the care team on what's common routine for the loved one, or if it's about their actually being involved in daily activities like helping at the mealtime or helping with dressing, helping at the physio, those kinds of opportunities could and should be available for families. So we're really trying to challenge our thinking today in how we can get our families or open the opportunity up for families who do want to be more involved and see that opportunity. And certainly during the pandemic, there were lots of times where we really needed families to be there with us, and when they could, there were lots that were lovely and stepped up to the plate for that. But we want to look at this as an opportunity to grow and learn into what comes ahead of us now, post-pandemic, or as we finish through the pandemic. What are the opportunities that we can now look at and rethink how we're approaching family care involvement? So, and the three speakers we have today are just amazing at this whole topic. First of all, we have Lisa Poole. She's a family care partner and advocate who will speak about her experience as a family partner in care. And then she'll be followed by Suellen Beatty, who's CEO of Sherbrooke Community Society. And she will be sharing some of the amazing family engagement stories that are being done at Sherbrooke Centre in Saskatchewan, both before and during COVID, and plans for what they're going to be doing after the pandemic. And lastly, we will have Dr. Jasneet Parmar and Dr. Sharon from the University of Alberta, who will be sharing an overview of their new program that supports health professionals in engaging families. So we're really thrilled for today's session, and I'm just going to kick it off and send it over to Lisa Poole to start us off.
Hello, everybody. Thank you for joining us today. Next slide, please. During the pandemic, there's been a lot of talk about the number of cases and statistics that show that people living in long-term care in Canada have borne the brunt of COVID-19. From an infection control perspective, it made perfect sense to lock things down, physically distance, and reduce social interaction to stop the spread of the virus. We all want the pandemic to end. But for people like my father, John, who lives in long-term care, the isolation and separation from family has been devastating, and it's been devastating for their families too. The numbers matter, but so does quality of life. Long-term care residents like my father are more than a statistic, and they deserve to be treated with humanity and compassion. Next slide, please. Since the pandemic began, stories of neglect and abuse have flooded the news. There were even reports of residents exhibiting symptoms of confinement syndrome, a prison term used to describe the symptoms associated with solitary confinement, which is typically used as a punishment. These symptoms include dehydration, functional decline, frustration, and depression. All these stories were resulted in tremendous anxiety for families who were not allowed to visit and who feared the worst for their family member in a residential care setting. Next slide, please. In BC, the issue of visitor restrictions generated more responses to the Office of the Seniors Advocate than any other issue in its history. Many people described the negative impact of limited or no visits, expressing more fear about loneliness than contracting COVID-19. Next slide, please. During the first wave of the pandemic, Ontario held a long-term care commission to investigate resident experiences. Residents unable to receive family or to leave their rooms for months described their pandemic experiences with words like lonely, muzzled, and trapped. Isolating people for months in an effort to keep them safe has been a failure, as many residents ended up getting COVID anyway, including my father, who, by the way, has had a full recovery. For many residents, the health risks of COVID-19 have been eclipsed by the health risks of loneliness and isolation. Next slide, please. The health risks associated with separation, loneliness, and social isolation can be just as serious as the health risks of COVID-19. And these health risks apply to both a care home resident and to their family care partners. A recent study published by Jasneet Parmar and Sharon at the University of Alberta reported that 40% of family caregivers with a family member in long-term care saw a significant deterioration in their own mental and physical health in the first few months of the pandemic. Restricting family from long-term care has created a whole new group of isolated people, mostly older adults, who have also lost their social connections as regular visits to long-term care were an integral part of their daily routine. Next slide, please. One of the recommendations in the U of A study is the need to recognize the essential role of family care partners who provide physical care as well as emotional and social support in all health and social care settings. Dr. Anderson and Dr. Parmar have developed an excellent 6-module framework for caregiver-centered care to help healthcare professionals understand the importance of recognizing family care partners as essential members of the care team. So if you're interested in learning how to better support family members who provide care, I strongly recommend this resource. And Dr. Anderson will be providing some more details on this framework shortly. Next slide, please. This is my family. Everybody in this photograph is involved in providing some kind of support to my father. Typically, or at least pre-COVID, a family member visited him every day. We help my dad eat meals and try to get him outside as much as we can. My father is used to having people around him who are supporting him, loving him, and touching him. Families notice when there's been a change that requires attention, which can be subtle and might be unnoticed by someone unfamiliar with a resident's individual tendencies. What might be normal for one resident is a cause for alarm in another. For example, on one occasion, my mom identified that my father had had a minor stroke that hadn't been picked up by staff. Families must be recognized as an essential part of the care team. Next slide, please. It's unrealistic to think that staff have time to provide companionship, especially under pandemic conditions. This is an important role for families. Window visits, physically distanced outdoor visits wearing masks, and video calls are better than nothing, but they're mostly band-aids. They at least allow families to see each other, but are not a viable long-term solution for meaningful connection, especially after more than a year. For people with advanced dementia like my father, who mostly uses touch to communicate, these options are deeply unsatisfying and largely ineffective. Touch is a fundamental human need. We need to ensure that family visits that include touch can continue to take place within the safe parameters of infection control, even during an outbreak. Safe touch is recommended by infection control experts who advise that physical contact and infection control are not mutually exclusive. There's variability between care homes about visitation policy, even in the same province. For example, in Alberta, even though most residents have been fully vaccinated, there are still some facilities that require physically distanced visits separated by a glass barrier. Next slide, please. COVID-19 has been hard on everybody in care homes, residents, their families, and staff. And there's been widespread chronic understaffing for many years. The virus has led to even further staff shortages, and remaining staff are overwhelmed and exhausted. If anything, family involvement is needed now more than ever. And just to be clear, I'm not pointing any fingers at staff. In fact, I think the people doing work in the care homes deserve our gratitude and recognition, and they're doing the best they can in impossible circumstances. And I know that my family is deeply appreciative of the efforts that have been made at my father's care home to provide his care, keep us informed, and facilitate visits. Next slide, please. An increased reliance on temporary staff means that there's a lot of different people providing care, which is not ideal for people living with dementia who need continuity and benefit from developing relationships with those who provide their care and understand personal preferences. One worker, one site policies introduced during the pandemic are a critical element for infection control and also an essential ingredient for consistent care assignments, proven to have many benefits as they allow for the development of personal relationships built on trust and emotional connection. Going forward, one worker, one site policies and consistent care assignments should be made permanent to facilitate both relational care and infection control. Next slide, please. A study conducted in Holland, published last July, shows no link between family presence and an increase in COVID-19 cases. Likewise, keeping families out of care facilities did not protect residents from getting the virus. As recently as last week, I heard Dr. Silvius, Alberta Seniors Health Medical Director, say something along the same lines during the telephone town hall about family presence that he hosted with Dr. Hinshaw, Alberta's Chief Medical Officer. Next slide, please. A new resource created by the recently formed Healthcare Excellence Canada, an amalgamation of the Canadian Foundation for Healthcare Improvement and the Canadian Patient Safety Institute, provides information that can be used by residents, families, care homes, and healthcare professionals to understand the roles and responsibilities of essential care partners. Next slide, please. If care staff can safely touch a resident under the right circumstances, which includes following infection control protocol and appropriate use of PPE, families can too. In a study of family care partners conducted last summer by Dr. Gwen McGann from the University of Calgary, 84% of respondents stated they are willing to undergo any necessary training in order to have continued access to the person living with dementia that they care for, living in a long-term care setting. Families can and want to learn about infection control and how to correctly don and doff PPE. Infection control protocol and safe family visits are not mutually exclusive. Families want to be recognized as essential partners in care, and we want to be able to see and touch our family members who live in long-term care settings. If there are new variants, future waves, and our COVID-19 case numbers continue to rise, the urge to look only through the lens of infection control must be resisted. The devastating consequences of isolation must also be considered. For many, especially after so many months, the value of family visits outweigh concerns about COVID-19. One worker, one site policies, consistent care assignments, infection control education, and PPE training for family members are key elements that allow us to follow infection control measures and provide quality of life for people living in residential care. Families must not be denied access ever again. Thank you.
Thank you so much, Lisa, for sharing your experience and advocating for what family care partners are looking for. So I'm excited to bring up Suellen Beatty next from Sherbrooke Community Society. She has some great examples of where Sherbrooke really excelled in engaging family care partners, and I think there's a lot for us to learn from their example. So welcome, Suellen.
Thanks, Hillary. I'm very happy to be here, and I too want to thank Lisa for sharing her experience as a family member. It's so real and so incredibly important. So I'll tell you a little bit about Sherbrooke. Sherbrooke is home to 263 people. We have about 500 staff and about 400 volunteers, although we haven't seen any of them for a year, just like everybody else. We are an organization that is very intergenerational. We have lots of young folks living here, as well as some people over the age of seniors, over the age of 100. And so we're very intergenerational. We have a grade 6 class that's actually based out of Sherbrooke, although they haven't been able to come in for the past year. And we also have a child daycare, Oak Trees and Acorns, and they actually haven't been able to come in to Sherbrooke either. So it's been just a very difficult year, and I really empathize with all the things that Lisa was saying. So our mission here is to create a community where each person can live a full, abundant life. And that means our residents, it means our families, our volunteers, our staff, everybody who is part of our community. And if you want to see more about Sherbrooke, you can go to the National Film Board and just type in a year at Sherbrooke, and you'll get a better idea of what this community is like. But I always describe it as a really vibrant community. I mean, it's sort of like you'll walk in the front door and you're just hit with all of this energy. And of course, I'm talking about pre-COVID times because that's all changed. But I just want to tell you a few things that were happening before COVID, and then what happened during COVID and what our hope is at the end. So I think one of the most important things is that we make family members welcome from day one. It's a very hard day for the resident and a very hard day for the family. And I think based on the readiness of the family, we need to offer involvement. But I think it's really important that families understand that we are in a partnership with the resident. And so we work together to create quality of life for everybody. So we ask families how they would like to be involved, and depending on how they're doing, they have a million choices to make. So I think recognizing that we're partners in care is maybe the most important concept here. You also have to recognize that there could be a really big role change for a family here. You may have been the 24/7 caregiver, and when your family member comes into long-term care, you might just feel exhausted, you might feel relieved, or you might feel guilty. all of those feelings are very normal. And so one of the things that we talk about is that we care for families as well as the residents who live here. So, you know, moving from that 24/7 role to one where you might be providing less care, and maybe you don't feel comfortable too, because I said what Lisa said, you know, the staff can take over. And of course, that's not what we want to do. We want to focus on maintaining that relationship as much as we can. So we have always had this open family presence 24/7. We've never had any visiting hours. And so families were here all of the time. And I tell you, there were so many different things for them to do. And I know I'm speaking in the past tense, but that's how this year has been. So of course, there's that opportunity to provide care as they did at home or may have done in the hospital. And then, you know, they should be part of the care planning process. And of course, this really depends on the resident that we're talking about, because, you know, some people don't want their families involved and some people want their families really, really involved. So it's really an individual kind of thing. And so we have to do that with families as well as with our residents. We never like to talk about groups of people. We are always seeing individuals first, and that includes families too. So some of the things that were available at Sherbrooke in the previous to the COVID year, it feels like years, was that many of our families would sign up as volunteers and just become involved in our community. You could accompany your family member to events and venues. You could come to the wine club and be part of the wine making. You could go to Diners Club, where a restaurant would come in once a month and you buy your ticket and reserve your spot in our large Tawa Center. You could go eat in the cafeteria. A whole family could eat there. And very often at lunchtime, you would see family and residents eating in the cafeteria. You had opportunities to come to big events like everybody has at Christmas and Valentine's and St. Patrick's Day and summer fun and all those outdoor things that we get to do when the weather warms up. You know, sock hops and church services and coffee parties, or going to our art studio, which is featured in that year at Sherbrooke. You can stroll through the community garden. You can stroll through our grounds. You can help people with their garden boxes. Introduce and help to connect with other family members. And I think this is maybe an area where we fall short, is there's such an incredible opportunity for friendships between and among families that we need to nurture. You could go out on an excursion. You could go to a Rider football game in Regina or go to a lacrosse game at Sass Place. You could go to Persephone, which is our live theater. So lots of families would accompany us when we went on an excursion and help everybody. We also have a tumbleweed gift and thrift shop, which is a very popular spot and completely run by family members and volunteers. And that's a really great way for family members also to have support and to make friends at Sherbrooke. So that's a really tight-knit group. And of course, that's been closed for the year too. We also have a mindful cafe, which is sort of a dementia cafe. And so families, some families have joined that as well. And then you can sit on Residents and Families Council, or you could actually, we have a family member spot on our board of directors, so you can get involved that way. So there were so many ways to get involved at Sherbrooke pre-COVID. So then COVID hit. And we clamped down with surplus safety like nobody's business. We just shut the place right down. And when I think back on it, there wasn't even a case of COVID in the city of Saskatoon, and we had this place locked up like a fortress. There was no more physio gym, no more special occasions, no groups in the art studio, no freedom to cruise the building, no freedom to go outside. In the neighborhood, in the house, the dining rooms, we were restricted to having 10 people there, although in our houses, there's only 9 people living there. But people started to eat in their rooms in order to keep our group sizes small. And people couldn't leave their neighborhoods. And of course, this is a very big building. We've got 8 neighborhoods in our high-rise building, which is only 4 stories, and you'd only call it a high-rise building in Saskatchewan. And then we have 2 villages where people live in 11 houses of 9 to 10 elders each. But then we have these great halls in this common area, and the place started to look like a ghost town. It was pretty terrible. So at first, no families were allowed to come at all, except for end-of-life care. And we tried to identify residents right at the beginning who it was just absolutely critical that they had a family member coming in. So we did have some families coming in, but families weren't allowed to eat or drink when they were here. They had to go straight to be screened at the front door, go straight to the elders' room, not talk to staff or visit with other residents as they made their way, which I know sounds absolutely ridiculous, and then stay in the room the entire time with their mask on, maintaining a 6-foot distance. And, you know, for us, where we've done all this culture change and trying to create this vibrant community, it was like soul death. It was so awful what we found ourselves doing. And we received so many different directives from our health authority, which we were very grateful for, because trying to navigate this scary time alone is just not a good thing. So lots of support from the health authority. But I have to say there was a lot of surplus safety as I look back. Then we worked to get residents outdoors because summer came, and we thought, well, we've got to get people outdoors, but you can't mix 263 people. So we had to create all of these separate areas, and we put miles and miles of fence up. It's still, when I look out my office window here, I can see all of these yards that we created for residents of other areas from neighborhoods to come, because we weren't mixing the neighborhoods. And the reason being is that if we did have an outbreak, we wanted to limit the number of people that could possibly be affected. So we set up 10 visiting areas, and that was very difficult for families. The weather wasn't always conducive, and it was very confusing for lots of people about why they couldn't get together. No one's allowed to pass anything over a fence or touch, and very, very difficult. We used our bus to get people out. We could go out for a country drive or through a drive-through, and so we did lots of that. But previously, we would have had family members with us, and of course, we couldn't now. We used our everything that we could. We redeployed all our resources to the neighborhoods to create this full, abundant life in a smaller setting. And you know, some things were really great from that. When Lisa talks about the consistent assignment, we normally do that anyways at Sherbrooke. But one staff working one place, cohorting happened quite early in Saskatchewan, and we were very grateful for it. And so we've got the same people every day who have developed relationships. And the staff are, you know, they love the elders and they love the family members. And we just terribly, terribly miss the family members because they're part of our care partnership team. So, you know, it was like people were just really locked up, and the, you know, the Eden Alternative teaches us about the bulk of suffering being from loneliness, helplessness, and boredom. And that was pre-COVID. And so we really saw that amplify. And so our staff, who I just have the utmost of respect for, just really rose to the occasion and got involved and worked outside the box, and nothing was too much trouble for them. And I think we were all kind of grateful that we actually got to come to work every day because we got to see people, and we realized how the families were lonely, helpless, and bored at home. It was sort of like the people who were living here didn't have the same rights as the people living in the community. And it seemed so incredibly wrong. And I think now, you know, with all of us having so many restrictions in the community, we have a little bit of an insight of what it might be like to live in a separated dementia care area, which of course we've gotten rid of those at Sherbrooke as well. And we have a dementia inclusive community. So one thing that we did do was we started to reintroduce our visitors back in because they were essential, and some provided care and some provided other kinds of care, emotional and social support. We had an education package ready. We did lots of education with families. We used lots of virtual education, and we actually prepared families to work in an outbreak situation so that we could have more hands-on and so they could be there. So now almost everyone's vaccinated, and I'm wondering when things will change. And of course, we don't get to make that decision. It comes from the medical health officer. So we're really looking forward to that changing. And I asked myself at some point, when do we start to test that vaccine? And so, one of the other things we did was we did tons and tons and tons of communication with families and with residents, daily and weekly updates. We did town halls. And in fact, we have another one tomorrow. And we've tried to maintain really good contact with our families so that they know what's going on, because it can be pretty frightening not to actually lay eyes in person with your family member. So we're trying to kind of ramp back up to where we were before. And it's difficult building back up because we don't know the future. We don't know what that's going to be like. But my dream is to get back to that incredible, vibrant community where everybody has well-being, where they find meaning, where they have autonomy, especially autonomy. Getting your autonomy back is just huge, where you can be connected to what's important, where you find joy, where you feel safe, all those things that make up our well-being. So that's my goal, is that the residents get back in the driver's seat and we create this vibrant community. So thank you.
Thank you so much, Suellen. I really loved your emphasis on partners in care. And we use the term care partner, family care partner, but really emphasizing that it's a two-way street, it's a partnership, and trying to cultivate that partnership. So thank you. A friendly reminder, feel free to throw questions into the chat and we will get to them at the end of the webinar, but you're welcome to add them in as you think of them. And next up, I would like to welcome Dr. Sharon Anderson. She's going to be presenting some of the work that she's done in partnership with Dr. Parmar. So over to you, Sharon.
Sharon, we can't hear you.
Am I unmuted now?
We can hear you now, Sharon.
Okay, and now I have to go back a few slides.
Thanks, Sharon.
Okay. All right. So thank you very much for inviting us. You might remember that back in 2002, Roy Romano, in his Future of Healthcare in Canada report, charged that the Canadian healthcare system wasn't sustainable without the work of family caregivers. Since then, there's been a plethora of reports and policies and research. We think it's time to act on those reports. And this is about culture change. And so our program is certainly about culture change. We're going to talk very briefly about why family caregivers need support, how we should support family caregivers, and then I want to present a really innovative solution is educating healthcare providers to work with family caregivers, to partner with them. So family caregivers are often referred to as a shadow or invisible workforce. 25% of Canadians are family caregivers, and they provide 75 to 90% of the care to people in the community. And pre-COVID, we're assisting with about 10 to 30% of the care in long-term care and supportive living. They provide 10 times more care than paid providers. In 2009, it was valued at $26.5 billion per year. Janet Fast calculated that contribution in 2012 at $66.5 billion. No wonder family caregivers are important. So the defining feature of family caregivers is diversity. You live in rural, remote, urban. You care for people of all ages with very different conditions. Dementia and cancer and stroke are not the same. So Conditions can start with sporadic care, as this slide shows, a bit of help with shopping and some driving, but stroke or cancer could start with personal care and could go for long-term care, but it could also go the other way for some period of time. So we really need to look at the diversity of family caregivers. And in 2016, 2018, researcher Stephen Zaret, you might remember the name, that's the Zaret Burden Scale, and Richard Schultz, who wrote the textbook, Families Caring for an Aging America, were both pointing out that we shouldn't expect a single course on care skills or, a quick intervention would sustain family caregivers along diverse care trajectories that are always getting longer. So we need to take a collective impact approach. There needs to be recognition of caregivers in government policies, age-friendly, dementia-friendly communities. Community organizations need to be part of that. Caregivers organizations, senior centers, Alzheimer's, Parkinson's, the other conditions. Researchers need to be working with us. The part that has really been missing is education and healthcare providers supporting family caregivers. That whole piece, they support the patient, much less so the role for family caregivers has been left out. So we were pleased to see Richard Schultz's 2018 paper proposing that healthcare providers should see family caregivers as more than a resource to follow their care plan, but rather as a partner who may need information, care to maintain their own health, and support to care. Achieving this requires that healthcare providers have the competencies to provide person-centered care to family caregivers, to recognize the caregiver's presence, assess whether and how they can best participate in overall care, engage and share information with the caregiver, recognize the caregiver's own health care and support needs, and refer the caregiver to needed services and supports. So we were ahead of the game in Alberta. In 2018, Dr. Parmar and a group of stakeholders had been working on this since 2014. And in 2018, they began to develop the competency framework, the skills, knowledge, and abilities that healthcare providers need to provide person-centered care and partner with family caregivers. There's 6 domains in the competency framework, each with 3 to 5 competency indicators. And we put them in a circle and label them from A to F because they're all important and they're all intertwined. Recognizing the caregiver role, communicating with family caregivers, partnering, fostering resilience. You can see here, this is the one that we have the indicators with, and as well, navigating the health system and enhancing the culture and context of care is really important. Let's change that system. So from November 2019 until, and we actually got it online, we filmed it in June. We were supposed to film it in March, but COVID interfered, but we managed to get it done. We filmed our education there's 6 modules. They follow the competency framework. There are the videos and interactive exercises. It's free online at caregivercare.ca. Anybody can take it from across Canada. And in fact, it's recommended for staff education by the Canadian Foundation for Healthcare Improvement, now the Healthcare Excellence Canada. They're part of their Essential Together learning bundles. And so I just want to give you a little taste of this education here now.
My husband's care needs are increasing, and I don't know how I can keep up.
I was a young nursing student when, shortly before my graduation, my mother, Charlotte, was diagnosed with young onset dementia. It made me a caregiver in every way. Luckily, I had lots of support.
Thank you for talking with me. I didn't realize that I needed to talk.
You haven't had time to think about your own needs, Lacey.
You'd be surprised at how many family caregivers feel just the way you do.
Exhausted, lonely, grasping for control, needing help they perhaps didn't even know they needed.
That sounds exactly like me right now.
Well, let's brainstorm about what you might need.
What do you mean?
Well,
thank you.
Be specific. Do you understand what your mom's going through with her illness?
Yes. No, not really. I mean, I've been trained in dementia, but living with it is a completely different thing.
Good, Lacey, good. Yeah, write that down. Maybe you could learn a little more.
Next question. Do you have time for yourself in the day?
That's easy. No.
That's likely not going to change after you graduate, right?
Probably not.
We should be asking all family caregivers what they need in terms of support to organize their care plan.
What do you mean, Cloris?
Take the Goodmans, Charles and Sally. As their case manager, I check in with Sally every so often to ensure my ongoing understanding of her needs. So 1, 2, 3, you can take that. Those are for you.
Super.
And you have all that. Like most caregivers, she doesn't always realize when those needs change or grow.
Sally's needs or those of Charles?
Well, one affects the other, but I make sure to have private time with Sally in order to see things from her perspective.
Well, she knows Charles' limits better than we do, and her own.
Mm-hmm.
All right. So we have large goals. We want all healthcare providers who work with family caregivers, from healthcare aides to doctors, nurses, pharmacists, and allied health professionals in all healthcare settings, primary care, home care, acute care, supportive living, and long-term care, to take this education. And since November 21st, 2021, we now have 990 people who have taken the foundational education. As you can see from the quote down here, a good introduction to caregiver-centered care helped to reinforce ideas already used in my care and highlighted new concepts that I can use in my patient care. So we have pages of these. We've got a lot of wonderful people giving us lots of kudos for it. We will have a new COVID-19 module online probably next week. We are hoping to have it on this week, but it will focus on some of those challenging conversations and how to work on that empathic communication and the navigation in these stressful times that we've had. We're going to be working on advanced education for healthcare providers with significant interactions with family caregivers. And we also have some funding to work on caregiver champions. So spread and scale within the champions healthcare setting and also in the healthcare system. We'd love to join you. We co-design this. We work with everybody. So if you're interested, please email us. Our education, again, is free online, caregivercare.ca. And if you've got questions, and our PowerPoint will be there for everybody to, if Hillary wants to share it as well.
Thank you so much, Sharon. That was great. We can send out these resources afterwards. We'll send out an email to all participants with the link to the recording and also the resources that have been shared. So that's great. So we can move on to questions now. I'm going to actually ask all of our speakers to turn your cameras on. You don't necessarily have to unmute yourself if you don't want to yet, but and participants, please feel free to continue adding questions into the chat. We have a few that we're going to get to here. And Suellen, thank you for addressing that. There are a number of questions for Suellen. We'll try to get to a few of them, but Suellen graciously provided her contact details if anyone wants to connect with her directly. So the first question that came through, thankfully we have one of our team members helping organize the questions. So thank you, Ali, for doing that behind the scenes. How do we move from staff or team members saying to family that you're not allowed to do certain things? And, you know, Suellen, you may be able to comment on this, but Lisa, you might have experience receiving that kind of feedback. Sherry, from CapitalCare's perspective, how do we address team members thinking that families aren't allowed to do certain things, and how do we get around that?
Thanks, Hillary. I do believe that that is part of the culture change. Culture change is difficult to do, but it's really necessary to change out of that old institutional paradigm where the staff take over and do everything into the culture where we want to create home. And so it has to be a partnership. And I think it's about the culture change and welcoming families in. It has to be a really active thing. So if you're not educating and supporting your staff to do that, they won't do that. So I think it's really a matter of leadership and encouraging that to happen.
Doesn't.
I can add to that. I actually know of an initiative called Family Involvement Project, and it has been underway in a couple of long-term care centers here in Edmonton, run by Covenant Health. Cecilia Marion, who is the director of those long-term care centers, can tell you more about it, but she worked very hard to actually overcome that very barrier. And what they offered were family caregivers actually an opportunity to be identified as partners in care and receive training. So they then set about and created 15 task-specific sort of workshops for family caregivers who were wanting to provide hands-on care. And these family caregivers then had the sort of pleasure and privilege of being involved and being acknowledged as having taken the training and partaking in the care. So I'm happy to connect you with Cecilia Marion. It took a couple of years to overcome also the union issues around this, and got a lot of legal discourse on it as well. So happy to share that information. Please use it. I'm always about not reinventing the wheel, because I think the time has come that we need to do something more formal in empowering families to actually participate in resident care, acknowledge them for it, and also help our care providers to accept them as partners in care.
And I'll just jump in and add too that I also think it's helpful if families understand the constraints that the care home operators are under themselves, or maybe they're not aware. And, I think as Suellen mentioned that the public health orders were constantly changing, and people are just trying to keep their heads above water. And so I think if we just try to work together, cut everybody some slack, even family members, if they meet resistance from care home operators, I think is to bring in some information that maybe they are unaware of. Like just to try to help educate everybody about how it can be done differently.
Thank you. Sherry, did you have anything to add, or should we head to the next question?
I think the only thing that, I think I love all the stuff that everybody else has been sharing. And I think the goal of this is always to make sure that we work collaboratively with our families, so that we really are truly making a care partnership, and is done with, with care and respect. And it really is a team approach that we want to see. But it's not, I think the idea is to move away from just the traditional model and move into some other areas where families really want to be part of things. And I love that Dr. Parmar shared some opportunities for learning there. So I think that's a great area that we can continue to move and push the envelope on.
Thanks, Sherry. So we have another question here. It's directed at Suellen, but happy for anyone to chime in with thoughts. So is there anything about the Sherbrooke community that you think will not go back to the way that it was after we have put the pandemic behind us?
That's such a great question. Of course, my hope is that we're going to be better and stronger at the end. But I hope that we can move out of this surplus safety that we have found ourselves in, and kind of living in this fear mode. And so I'm really hoping that we lose that and that we become stronger. So I'm hopeful for the future.
Thank you. We have another question here just asking about how do you deal with the barrier to culture change of what feels like a punitive institutional model of care, or potentially, you know, where there are policies and legislation in place? How do you tackle that when you have kind of staff attitudes of that's not allowed, but maybe, you know, sometimes I know we've talked about this, you know, where is that rule actually coming from? Sometimes it's almost a perceived rule and not actually a hard and fast rule.
Are you wanting me to answer?
You
that?
are welcome to answer, Suellen, if anyone else has thoughts, but you
Okay.
you go ahead, Suellen.
I really think it is about leading culture change and about creating a lot of value, the mission, vision, and values, having everything aligned that includes all of those things. And I think so much of this is about staff education and helping them to understand. And when we look at a regulation, we need to look at the intent of it. Some people just kind of follow the rule and miss the intent of a regulation. And so we get into some surplus safety and some rigidity. And so I think we need to look at what we're trying to accomplish and make sure that we do lots and lots and lots of staff education and, you know, sticking to our mission, vision, and values.
Yeah, absolutely. I think having the right mission, vision, and values goes a long way. Some of what we've seen in our in our, and I'm going to generalize it to all healthcare facilities, not just long-term care, is heuristic. And that is basically, we have just learned over time how we remain patient-focused, and families are just people outside our circle of care. So healthcare providers, and this has come from years of work. We started this work in 2014 and gradually unpacked the story. Healthcare providers have never been educated about the role of family caregivers, their contributions, the consequences, how they can engage with them, communicate with them, and how their support actually makes a difference, not only in the lives of the patients they care for, but also in the lives of family caregivers. And having this relationship-based care is actually therapeutic for the healthcare providers as well. We have missed that opportunity over the last many decades. So we've gone on to become actually increasingly disease-focused, advanced technology, patient-focused, creating lean systems of care, and not recognized the contributions and the value of family caregivers. And in fact, what happened in the last half a decade, because now we were challenged with the fiscal restraints of the healthcare system, we actually started to shift more and more care via very strategic initiatives into the community, aging in place, etc. All this actually created more dependence on family caregivers. And literally what we did was we shifted care from within our settings onto family caregivers. So our lens needs to be corrected. So we've been doing patient, resident, and client care from this lens of the healthcare system and the lens of the healthcare providers. And when you speak of culture change, I hope that's what you mean, you know, that we need to change this lens. We need to be looking at our patients, residents, and clients as in that family unit with the family caregivers. And we know now that looking and caring for them as that unit makes a huge difference in how the care planning, delivery, decision-making, and outcomes get impacted. So I think some of it is just what has happened over time organically. And the only time you see healthcare providers engaging with family caregivers differently is either they have observed good role modeling, or intrinsically they have these personalities, or when they become family caregivers themselves. So I think the time is right. We have far more family caregivers than we ever had before. And if you look at majority of family caregivers now, or 60% are working. So even in the healthcare system, you can presume 50 to 60% of these healthcare providers are family caregivers. So I think they're ready, but we still have to, in an organized manner, and provide them that education and training and support to do the work. And that brings me, of course, to, again, the mission, the vision, the values, policies, protocols, and standards of care.
Thank you.
And I just want to jump in and say that I think that policymakers should also be considered as part of the care team, and that we need to make an attempt to reach out to them, because people only know what they know. And so if people feel strongly about something, say like caregiver-centered care education or other aspects of including family in a more robust way than the policy allows, we need to let them know.
Thank you, Lisa. I'll just comment that I know there's lots going on in the chat. There's a lot of great resource sharing. So one of the questions was about training for family care partners themselves. Dr. Anderson and Dr. Parmar have shared training for healthcare providers. So Ontario Centres for Learning, Research and Innovation in Long-Term Care have some great resources, and that link was shared in the chat. Family Councils of Ontario, which is based in Ontario, of course, has shared some as well. So feel free to check out the chat as well. I just wanted to, or as we kind of start to wrap up, I just have one question that's still, sitting with me, is what's next? We've kind of touched on that we may have missed the mark here in balancing infection control and quality of life. And perhaps understandably, this was all new to everyone. It was very confusing and scary, but what do we want to see moving forward? Is there one piece of advice you'd like to share, or one vision that you'd like for family care partners as we move ahead from this?
From my perspective, I think the minute that people need to move into a long-term care home or any sort of residential care setting, that they should be onboarded and their family should be onboarded with infection control information or PPE, or even orienting to what the care home, how they can help out, how they can be involved, so everybody is on the same page and everyone has the information that they know. Because often what happens right now is you show up and you kind of get slotted into a room and you sort of figure it out on your own. So I just think if we improve the communication and sort of imagine that another pandemic might be looming, and what do we want people to know in advance? Like, let's be proactive about creating all the conditions that we need so that families can continue to be involved.
Thanks, Lisa.
Well, I'd like to see family caregivers to be recognized in legislation. I think every province needs legislation that recognizes family caregivers, and from there flows, hopefully, the policies that are needed for various stakeholders, including, and I'm going to include the healthcare system. Sharon had a slide which showed multiple stakeholders that need to rise to this occasion of supporting family caregivers. So our age-friendly communities, our community organizations, government, employers, and I'd like to say healthcare system needs to be part of that circle. And the policies that emerge should empower all these stakeholders to take on the mandate, which is relevant to their area, their scope. And from there, hopefully will flow ongoing collaboration and coordination to wrap services around family caregivers. There's so much work that's going on in training family caregivers, awesome organizations and courses, etc. But we need to build a better system that supports the family caregivers along with the people that they care for.
Thank you.
Yeah, and if I can just jump in, I think the other thing too, then I love Lisa's comments is, families who want to be involved have such great skill sets, and they have things that they can do to be part of the community. And Suellen talked a lot about the vibrancy of the community that they have at Sherbrooke. And I really think that for me, for sure, looking forward into the future is how do we really engage the families in a way that fits for them and for their loved ones and for the center. They may be people who are interested in not just looking after their loved one, but being involved with other residents in ways that really add to the community as a whole. And I think that when we start to see families as part of the community, where they're not, they can actively be involved in the daily activities and routines of their loved one, but in ways that are maybe different, like I said, with physio or with dressing or getting ready, getting the makeup on and doing the hair and all those things that are things that traditionally are care staff roles, but they also could be great leaders in small groups of, leading the knitting group or helping with the physio and maybe even, doing fun stretches or, things like that are just really out of the box. I think we have lots of opportunities in front of us. And I love I definitely love all the resources that people have been sharing here. It's amazing. So
it looks like we're getting close to the end of time. So I just want to thank everyone for joining us today, and also thank you to all of our speakers, Lisa, Suellen, Sharon, Jasneet, for joining us today. We really appreciate you sharing candidly your experiences over the past year and also sharing with us what the future looks like. And I think we're all very hopeful that we have some great resources and education in place so that things will be different as we move out of this pandemic and prepare for, I hate to say it, but the potential of future situations that are similar. So I will put in one final plug for all of you to mark your calendars for May 26th, 27th, 2022. We hope to see you in Calgary. And we will also be continuing our Rethinking Senior Living webinar series. So stay tuned for more on that. We will send out an email with a very short evaluation survey. So let us know what you thought of the event today. That will help us in future planning. And once we've got this recording tidied up, we will send that out along with some of the resources that have been mentioned today as well. So thank you very much, everyone, and enjoy the rest of your day.